So my name is Agam Dewan. I'm a board certified psychiatrist and have helped over 200 PMHNPs and FNPs gain clinical confidence in their psychiatric diagnosis skills, their treatment skills, and getting over imposter syndrome to actually help their patients get better results. So in this video, I'm going to be sharing a prodromal schizophrenia case that one of my students brought up to us in our coaching program. So she presented us we had a 19-year-old male. And so this guy has been having some depressive type of isolation symptoms since March. So what she said was that this patient has been isolating for about 5-6 months at the time of this recording. He has not been engaging socially. So isolating, decreased social. This patient was also in school, and so they've dropped out of school. So no school. They are hiding in their room a lot more. So I say isolating room. She says that when the patient was in the appointment, there was very little eye contact and speaking. The family was doing the speaking for the patient. They've also stopped driving. So in terms of school, they were in college, actually, and they dropped out of their college program. So that's a big thing. The family also said he spends hours in the bathroom. So the patient spends hours in the bathroom not doing anything productive, just running the tap on. And so when my student said that, that really reminded me of a separate case where I had another patient who I suspected had prodromal schizophrenia. And this patient, what the family described was that he would try to make a peanut butter sandwich and he couldn't do it. Like he would just stand there trying to figure out how exactly do I make this peanut butter sandwich. And I forget exactly what the family said, but I remember when I heard it, I remember immediately thinking, wow, like this guy's losing severe loss of function like that. Like this is a prodromal schizophrenia case. So the bathroom, the family says he walks slowly. So his gait has slowed down a lot more. And he'll stand in front of trash can. So all to say that, so basically when she was describing these symptoms in our Q&A call, everyone else kind of had the same thought too. Yep, okay, this sounds like prodromal. And I think what further solidifies it is no benefit on Prozac. So in March, when they were having the symptoms, they tried Prozac. And so since then, there has been no benefit whatsoever. So this, when I heard this, like this is a very typical presentation of prodromal schizophrenia. Someone starts off doing well, social, living a normal life, and then slowly they start regressing over time. What makes this case hard is that there's no positive symptoms. So there's no delusions, hallucinations, paranoia. There might be some subtle paranoia that the patient's not mentioning, but there is no overt or frank hallucinations or delusions that are noticed. So this is in the early stages. And so the way that schizophrenia develops, so it's split into 3 different categories. So from 0 to 1 month, so this is called brief psychotic disorder. And then from 1 month to 6 months, this is schizophreniform. And then from 6 months onward is schizophrenia. Basically, this is just the timeline of how the symptoms develop along a long time once they meet that full criteria. So this guy's in a prodromal phase, so he's somewhere like over here. So that's why it's super, super important to understand that and be aware, because this kind of presentation, so as we saw here, they tried out the Prozac and the Prozac didn't work. But now the patient has wasted 6 months being on this ineffective medication when they could have been on a better regimen. So the treatment for this, very important to diagnose. So it is antipsychotics. So you want to get the antipsychotics on board, even if they're not having any kind of overt positive symptoms, because still treating the negative symptoms prevents their brain from deteriorating, and it can, in fact, decrease either the speed of progression or the amount it progresses. All right, so decrease progression. So either decrease the progression speed or final destination. The worse that someone gets into psychosis, schizophrenia, the more brain cells it loses. It's actually damaging to the brain. So we want to intervene as soon as possible to prevent further deterioration in this patient's life. So in this case, the provider started Abilify, which is perfectly reasonable. Other options are Abilify, Zyprexa, Risperdal. Basically, you can, etc. Basically, you can do any second-gen antipsychotic. I would lean, especially if the symptoms are more mood-based, to like a mood-based one. So Zyprexa, Abilify, Seroquel. Because these have mood benefits too, they don't fully only have antipsychotic benefits. For example, Haldol is just purely antipsychotic. But in this kind of case, there's a lot of mood stuff that you're addressing too. So that's where the mood-based antipsychotics can also be helpful. Yeah, but that's the mainstay. You want to get these on board, so you want to make sure that you know how to diagnose this. And then, I mean, that's one thing. But then the second thing too is getting early psychosis groups. So the patient needs support now. The family needs support. So getting them into any kind of early psychosis group. There's a lot of them, I mean, virtually as well as in person. The local hospital system could help you get connected with that. Just finding something like that can be really helpful for the patients who are having this early schizophrenia. So, for example, I have this case where a lot of the family, like the kid, I met this 16-year-old kid, and she described that, yeah, he used to be social and stuff, but then around age 13, 14, started regressing more, going through music. His hygiene has suffered greatly. Classic signs of prodromal. So I started him on antipsychotic, on Latuda specifically, and now I just met with the mom literally yesterday, and she said, wow, like people can't believe the difference that he's having. He's way more social. He's a lot more engaged in his hobbies. He's attending summer camp right now, and like people are really loving him and spending time with him. And he's had a huge gain over the last 6 or so months. And I think a huge part of that is that we started the treatment, the antipsychotic intervention early. So very crucial that you know how prodromal schizophrenia presents and how to recognize it and then how to treat it as well. So this is the kind of thing we do very commonly in our PMHNP coaching program, where we will have our students present cases, and then I will give my personalized advice and feedback on how to treat them true and like how I would approach that case. So, if that's something that you want help with, your own psychiatric cases, and you want to deepen your level of psychiatric understanding from a board certified child, adolescent, and adult psychiatrist, yeah, I would recommend doing that in our coaching program. And we've had over 200 people right now stay in the program. So we're growing faster than ever. And so you definitely don't want to be missing out on this learning opportunity. So you can check that out, and I will see you later.